Hi, everyone. I'm Tim Bethune, Chief Program Officer at Serious Fun Children's Network. And we're here today to talk about a really and timely and meaningful issue, kids' mental health. It's May, and May is Mental Health Awareness Month. And about one in seven kids and teens globally are impacted by a mental health condition. And for those of us who work with youth or had children of our own, we're seeing this in our communities. We are seeing more children facing anxiety, depression, trauma than ever before. So I'm curious from your perspective, Katie and Kiana from at JED Foundation, what is it that you think is driving this increase, and what are you seeing across young people today, sort of in this space?
Well, I would start by saying that what we always say, which is that mental health is multifactorial. So it's difficult to pinpoint one specific thing, especially when you have different populations of kids. Like your camps cater to kids with long-term medical conditions. So right there, sometimes the long-term medical condition is something that can contribute to anxiety or feeling a little bit isolated outside of the camp setting when they're in their school setting. We know that kids and teens are experiencing higher rates of achievement pressure and anxiety. We also know that there are a lot of kids in this country who are struggling to have their basic needs met. So we're always thinking about social determinants of mental health and systemic, contributors to poor mental health. So, we think about kids who don't have breakfast in the morning before they go to school, who maybe don't have a safe place to sleep or aren't sure that they have a safe place to sleep long term, maybe inadequate childcare because that's not something that's provided in the way it should be in our country. So, we look at all of those factors, systemic, societal, and then individual factors that may contribute within both communities and just individual families. And it's complex. It's highly complex, and that's why we take this public health approach to suicide reduction. Like we have to think of all of those buckets, right? And we have to, assess carefully and really consider where these kids are coming from, meet them in their moment because every kid is having a different experience, and start there.
Yeah. You know, Several of our Serious Fun camps have begun engaging in these discussions around mental health with their communities. And I think in general, the camps across Serious Fun's network are just really intentional about listening to the needs of the families and of the campers and that are participate in their program. It's really just core to how we operate. And we've begun to see some really significant additions at several Serious Fun camps that are now really expanding mental health support and programs in a really big way. And Laura, I'm wondering if you might be able to jump in and just share what is this looking like in action now?
Thanks, Tim. Our camps are doing some really exciting things in the realm of mental health, in a large part because we know that kids with special healthcare needs are often more likely to experience isolation, anxiety, depression than their healthy peers. So, mental health challenges are present for many of the kids that we serve. Now, our founding principle of our camps are their camps for kids who wouldn't otherwise be able to attend camp. And if you stop and think about that just for a moment, like the rite of passage that camp experiences can be for kids who can't attend camp, that just can be very isolating, and that was one of our central purposes of why we created the Serious Fun camps. But now we understand that also kids with serious mental health conditions also have trouble accessing camps as in sort of the mainstream form. So we have several Serious Fun camps, Ohio, Italy, Colorado, who are now offering dedicated mental health programs where the mental health conditions like anxiety, depression, PTSD, or panic disorder are actually the primary qualifying diagnosis for camp attendance, which with Serious Fun camps is always free. So this is really meeting allowing kids to meet other fellow kids who've had their same experience. We know that in serious medical conditions, finding another kid who looks like you, who's had your experience, where you don't need to explain that part about that, and you can just go and have fun, that's part of the healing, is to feel not alone. And so we know that the same is true for kids who are navigating depression or any other mental health condition, that they leave camp feeling more connected and less alone. And when you think about camp as an intervention for certain as an intervention that can help us feel more connected, I think we can all agree that having that experience available to as many kids as possible would be really important.
So I have to mention at this point that some of the programs you've mentioned, Laura, in the countries and the regions are really they're generously supported by our friends and our partners at Abercrombie and Fitch, who, and here's a bit of an insider scoop, Abercrombie and Fitch kindly introduced us to you all at JED Foundation, and we're really the catalyst for making this collaboration possible in the first place. So thank you to Abercrombie and Fitch and Co for that. And so now we're collaborating to expand mental health support for every camper, regardless of their diagnosis, be it sickle cell or epilepsy. And so, Katie and Kiana, I'm curious to hear a little bit from you about, what are you seeing as the vision for this work with Serious Fun and this collaboration?
For example, in working with Serious Fun, we're really thinking about the different campsites, what the needs might be. We know that anxiety and depressive disorders are, increasing among young people. And so we want to help with different kinds of policies, checklists, preparedness, just basically all the different components that can help your camps be really ready in case kids are struggling with more than just the anticipated homesickness or feeling a little bit worried.
I would love to add to what we've already shared about that. So whenever someone is in our technical assistance program at JED, really the first thing we do is an assessment, a deep assessment of what is already working really great and where there are opportunities to build out that safety net that Katie talked about a little bit. And we come from a strength-based approach, and we found so many strengths with Serious Fun in the way that they are trusted and connected with young people that they support, but also in just how deeply caring their staff and their volunteers are about the work that they do. It's very heart-led work. And so I think from that assessment phase, we really work together to co-develop a strategic plan with Serious Fun around what we wanted to accomplish during this time together. Because typically we work with organizations for about 18 months, which sounds like a lot of time or a little bit of time, depending on how you look at it. But we set really three big goals together. And those were, we wanted to make sure that for camps that didn't have a mental health specific crisis response protocol, that they had that. And we wanted to learn from the camps that do, because many of Serious Fun's camps already do. And so we've worked on that kind of at the national level to be able to have that additional resource that can go out to any and all camps that would find it helpful and useful. We also wanted to make sure that beyond that, there was a readiness checklist to go beyond just, okay, you have a crisis response protocol at your camp or your site, but have you kind of thought about these other factors that might also be important to making sure that students can have a joyful and safe and wonderful time while they're at camp? And then the third goal is about training staff to make sure that they feel ready and confident to be able to use those tools. And also to know their limits, because oftentimes whenever people do this really beautiful heart-led work, it's not so much getting people inspired to show up. It's kind of being like, okay, yes, inspired, yes, listen, yes, connect and support, but also sort of know your limits and your boundaries there to make sure that you can not kind of overextend yourself in a way and connect with your team to really build out that community of care at camp. So making sure you're relying on your colleagues, your coworkers, the medical, the behavioral staff to support you and to support the camper. And so those were the three big pieces, but we've also expanded into a couple of other areas as well, which has been great and fun to see this grow. But I'll stop there for now.
I love that. This really speaks to how this partnership is going deeper. At Serious Fun, we've, always strived and did everything we could to support a child's emotional well-being. And this really is about taking it to that next level and going a bit deeper. And I'm curious to hear, what it looks like in practice when a camp leader maybe is recognizing that a child is struggling and that they know how to respond.
One of the things that JED has helped lead us through, Tim, in response to that question is a mental health training that we're making available across the network and is going to be translated in several languages, which is just amazing gift to be able to do. But part of that training is giving people real skill sets for what to say in the moment. I think as we frame shift from mental health being something that we don't talk about to something that is clearly something that we need to put front and center alongside alongside sickle cell disease or any other diagnosis, we haven't equipped generally we need to upskill so that we know how to we know about stopping bleeding, we know about all sorts of things that we do, like concussion. You lay them down, you have to have somebody's having a seizure, what do we do? But what do we do when somebody expresses that they are feeling very emotional or feeling psychologically challenged, and camp is a place where we do challenge by choice, and so we know that we will be asking people to challenge themselves. Giving those, Jed has helped us see that there are some very, very tried and true evidence-based responses that we can employ in that setting, and making sure that everybody feels comfortable doing so is part of the outcomes of our partnership. So really looking forward to getting that training out. We're looking at 2027, right, Kiana? Is what we're hoping for.
Yeah, and I would just add to that at JED, we firmly believe that anybody can learn how to talk somebody else through distress. So whether it's young people or, older folks or just across age groups, like we believe that the more we train people to learn how to use mental health language, how to stay calm, how to ask the best questions. It's not right or wrong. It's just what's the best question in this moment? What's the information I need to get in this moment? And then learn the pathways to care wherever you are in time and space. If we can do that, if we can train enough people, we can really create a massive village of folks who know how to help one another out through difficult times. And that's kind of, not in our mission statement, but maybe in my mission statement as someone who works at JED, is just train all the people, because when we're on the same page and we use the same language, and we learn how to listen, we really can help each other through difficult times.
Katie, that sort of perfectly tees up where the next question is going, because JED you've worked with hundreds of institutions, reached millions of young people. I'm curious, like, what have you seen in terms of outcomes when this kind of approach is implemented well?
Well, we know that in our campus program on college, universities, colleges, community colleges, we know that when a system completes the JED campus program, that they see a 25% decrease in suicidal ideation among their students. So that's huge. That's a big deal. And a huge part of that, Kiana was touching on it earlier, is really building cultures of care, building cultures where talking about mental health is normalized, where asking for help is encouraged, not just something that is available, but something that is actively encouraged. So when we really build out those intricate safety nets for the environment, we see a decrease in attempts and ideation among young people.
Yeah. Laura, I'm curious from your perspective, sort of at the end of the day, what does mental health support mean for a child arriving at camp who may be struggling?
I think what excites me most, perhaps about this partnership and this focus is bringing into alignment the whole child, right? Is that we cannot separate serious medical illness of the body from any other type of illness or disorder. So what this does to me is it normalizes and it frame shifts into more of a whole child approach, and that to me is very exciting, because that is really the magic of camp. When you start to peel apart what we do at camp and why it's so magical, is I think a lot of people do feel whole when they're part of a community, when they have adults who care about them, when they have a place that notices them and really sees them, not only for who they are, but also for how they're approaching challenges, whether or not that's with ease or whether that's with difficulty. And so I'm making camp a better prescription for kids. It's always been a great prescription for kids, but by this sort of work and this sort of partnership and skilling up our camps, we're really giving a better prescription for kids.
I think that's the perfect way to set up. Laura, hey, Yana, thank you so much for your time today, sharing your expertise, your passion for this work. It's very clear that obviously when organizations come together with a shared commitment to young people, like we really can create environments where kids are feeling seen, supported, where they feel like they belong and truly connected. And so this work is only possible because of a community of supporters, partners, volunteers who believe in what we all do. And if you'd like to learn more and get involved or support our work, you can visit seriousfun.org or jedfoundation.org. Thank you for joining us and being part of this conversation and supporting kids' mental health.
Thank you, Tim.
Thanks, everyone.
Thank you.